Hello everyone, today we are going to learn Module 3 about insulin delivery and administration from the Nurse Delegation Diabetic book. We are doing lesson 8. The first part we're talking about today is about vials and syringes. The syringe has 3 primary parts. And the hub that attaches the needle is in here, over here, and the bearer that contains the measurement mark, and the plunger, which is here, that's used to withdraw and inject medication. A note to safety is many different medical devices have been developed to reduce the risk of needle sticks and other sharp injuries using current OSHA standards. A safety syringe is a syringe with a built-in safety mechanism to reduce the risk of needle stick injuries to healthcare workers and others. The needle on safety syringe can be either detachable or permanently attached. On some models, a sheath is placed over the needle, whereas in others, the needles retract into the barrel. There are different kind of gauge of injections for a needle. There are syringes made specifically for insulin administration, and these are the only type of syringe that should be used for injecting insulin. Insulin is measured in units. Syringes vary in terms of how much insulin they hold, as well as the length and thickness of the needle, as the book shows here. The needle must only touch the vial top as you prepare the insulin dose. If the needle touches anything else, it's contaminated or no longer sterile, and you must discard it and start over with a new syringe. Discard a bent needle and use a new syringes. Needle and syringes should never be used more than once or used on more than one individual. Vials. Insulin used for injections may be stored in vials. The insulin within the vial is sterile. Vials are glass containers with rubber stoppers on top, just like this one. We usually insert needles on them to withdraw insulin. To draw insulin through the needle and into the syringe, the needle must be inserted into a vial so that it's completely covered by insulin. Pulling back on the plunger top will draw the insulin into a syringe. We will go more in detail later on this class. Completely cover the needle. We have to completely cover the needle with the insulin. Remember to write the discard date, currently 28 days from the date of opening, unless otherwise instructed on the vial in the box. The best way to measure the insulin is to hold the syringe and the dosage measurement line at the eye level, like that. To draw up the insulin, pull back on the plunger top. Use your finger to pull on the edge and the plunger top only. The barrel is the main body of the syringe that holds the insulin dose. Insulin is drawn through the needle of a syringe into the barrel. The barrel has marks and numbers that relate to the insulin units for standard dose of prescribed insulin. Always use an insulin syringe for insulin. Look for orange tab. They usually have a tab for orange. Be sure the syringe and the insulin match. Usually they are U100. So it has to be U100 on the syringe and U100 on the vial too, same time. Here, it shows here, this is U100 on the syringe and U100 on the vial. You see they have the yellow cap all the time. Vials have specialized rubber tops. When a vial of insulin is new, there is a cap that covers the rubber top of the vial. For a new vial, remove the cap from the rubber top before cleaning it. You have to clean it. The rubber top of a vial does not lift or come off. Instead, it's soft enough to let a syringe needle pass through it to draw insulin out of the vial. The rubber top keeps germs and bacteria out by closing off or sealing over the hole where a needle was placed. Each time you use a vial, clean the rubber top with a sterile alcohol wipe to keep germs and bacteria out of vials. To do so, start in the center of the rubber top and use a firm circular motion as you work your way outward to the edge of the rubber top. Be sure to let the alcohol dry completely before inserting a needle into a vial. Vials are sealed, that they're like airtight. Insulin vials are sealed airtight. This means that you need to inject the same amount of air into a vial before you can draw that amount of insulin out. If you inject 1 unit of air into a vial for every unit of insulin you want to draw out of the vial. The prescription label you see over here. Labels on the small box that insulin comes in. The medication label is found on the vial itself. The medication label identifies the name or type of insulin in the vial, the number of units of insulin per milliliter in the vial. U100 is the standard. The expiration date of the vial. Because insulin vials have 2 labels, one on the box and one on the vial, you will need to store the vial in its original box and check both labels when you are verifying the 6 rights of medication administration. Currently, once opened, vials can last 28 days. Make sure to write discard date on the vial and the box 28 days from when it was opened or by expiration date, whichever comes first. However, many different insulin types as well as non-insulin injectables have different discard by dates. It's important to work closely with the delegating RN and the pharmacist to identify specific dates by which open insulin vials or pens must be discarded. Insulin products contained in vials or cartridge, opened or unopened, may be left unrefrigerated at a temperature between 59 degrees Fahrenheit and 86 degrees Fahrenheit for up to 28 days and continue to work. Now we're going to look at the pros and cons of using syringes and vials. Sure, we covered all this. Yeah. The pros of using syringe and vials are some syringes allow you to mix insulin. It's less expensive than pens and smart pens, and syringes vary in size, gauge, and length. Syringes are easily available and may not require prescription to obtain. May not, it's not all the time, are covered by most insurance plans. The cons of using syringe and vials are you need to remember all the steps involved in drawing up a dose of insulin, typically marked in 2 units of increments, which can make it hard for people who need to take odd number dosages. Wasted insulin, since a vial of insulin needs to be used 28 days from opening it and must be disposed after this time, even if there is insulin left over. Now let's look at about pens. Insulin pens got their name because they are about the size and shape of a writing pen. Insulin pens are preloaded with insulin. There are 2 types, disposable pens and reusable pens. Disposable pens come filled with insulin. You throw the pen away when it is empty or expired, but reusable ones where you replace the cartridge of insulin. You replace the cartridge when the insulin is used up or expired. Insulin pens need to be primed before each injection. Priming is testing the pen by injecting a small amount of insulin into the air, usually 2 units. Insulin pens are for just one person to use. Remember, they should never be shared, even if the needle is changed. Sometimes blood can get into the cartridge after a shot, which can expose others to infection if the pen is shared. The pen uses a needle, but it is shorter than the needle on a syringe. A new needle needs to be attached onto the pen with each shot of injection. The needle then needs to be removed and disposed of after it's been used once. As was the case with syringes, pen needles are available in a variety of lengths and thickness. Make sure the delegating RN reviews the instructions for the client-specific pen. You can familiarize yourself with the manufacturer instructions, which can be found online. Pre-filled insulin pens and pen cartridges that have not been used should be stored in a refrigerator. Insulin pens or their cartridge may contain a single type of insulin, or they may contain 2 types of insulin pre-mixed together. All pens will come with a prescription label and additional medication label on the pen cartridge. Currently, once opened and stored at room temperature, a pen is good for 28 days before it must be replaced. And this shows the parts of the pen. This one is the cover. It's called the pen cap. A pen cap, this protects the insulin where you are not using the pen. And a rubber seal is right here. This is where the pen needle connects to the body of the pen. You put the needle on it. An insulin reservoir is right here. This holds the insulin. There is a clear plastic area that lets you see the insulin inside the reservoir. You can use this to see about how much insulin is left in the pen. A label is here. This, there usually something on it that tell you the type of insulin in the pen and the expiration date. A dosage selector is around here. You can roll it. This lets you dial to the right insulin dose. A dose window, which is right here, tells you the number. This shows the number of units of insulin selected. There is an arrow pointing to the number in the middle of the dose window. This is the number of insulin units that will be infected. An injection button is the last one over here. This is the one you push. You press down on this to give injection. General pen rules and concepts are: insulin pens will be either clear or cloudy. For cloudy insulin pens, you need to roll the pen gently between your palms, between 15 to 20 minutes to mix it before use. Once used, an insulin pen should be used until it expired. As with vials, write the discard date on the pen. Insulin pens should not be stored in the freezer, and they should be discarded if frosted. They just stay in the fridge if they're not open. Insulin pens should not be exposed to direct heat or light. Should have an extra insulin pen or cartridge available in case the one being used gets lost or damaged. Insulin units that are measured on insulin pen match the unit of standards, which is U100. Insulin with a U100 on the syringe. New or unused pens need to be stored in the refrigerator. Once in use, Pens must be stored at room temperature. Insulin pens in use must not be stored in the refrigerator. Insulin pens do not have needle attached to them the way syringes do. Instead, the pen has a protective cap that comes off so you can attach a new sterile needle each time you inject insulin. Safety pen needles. Some pens will have automatic safety shield cover that protect the needle tip after use. The shield locks automatically at the injection end after use to prevent the needle stick for injuries. Disposable needles for insulin pens come in plastic container so they remain sterile until use. With pen, there is no rubber vial top to clean, and instead there is a rubber seal on the end of the pen. The rubber seal must be cleaned with a sterile alcohol wipe before a new needle is attached. Insulin pens must be primed before they can be used. Priming means testing the pen by injecting a small sample of insulin into the air, usually 2 units. Priming has two purposes. It tells you that the pen is working. Insulin comes out when you push the injection button, just a little bit, a drop. And it removes air that may be in the cartridge and needle. Instead of using a plunger, insulin pens use a dose knob that you turn to prepare a dose of insulin. The dose usually appears as a number such as 10, 8, 4, something like that, and a dosage window to indicate how many units of insulin will be injected. Many types of insulin pens instruct you to push the injectable knob in and hold for 10 seconds when you are injecting insulin generally. Insulin pens are not stored with a needle attached. Needle must be removed and placed in a sharp container immediately after use. Leaving a needle attached to a pen may cause insulin to leak out or clog the needle or create air bubble in a cartridge. Remove the needle. Put the large needle cap carefully on the needle. Twist the cover needle to unscrew it. Throw the used needle away in a sharp container. Now let's see how do we attach the needle to the pen. First, we have to perform hand hygiene, and then wipe the end of the pen with alcohol where the needle is attached. And third, pull paper top off pen needle and screw the needle into insulin end of the pen, and remove outer needle cover and keep nearby. Remove the inner needle cover to expose the needle, and throw inner needle cover in the trash. I will have another class about how to do it, and I will show you how to do it while I'm doing it. That way it's easier. Okay, what are the good side of it using a pen? What's the bad side of it using a pen? Let's start with the good side. The pros. That's a good side of it. Most discreet than syringes and vials. Small size and likeness to ink. They look like ink pens. Make insulin pens a convenient and discreet way of carrying insulin. It's just easier. Often less painful than syringes because they have smaller needles. Easier to use as syringes because easier to give exact dose. It's already pre-filled. You don't have to draw. Normally get enough to last a month usually. Fewer steps to inject insulin compared to syringes. When you look at about the pen, the cons are the pen needles need to stay in the skin slightly longer than a traditional syringe injection. They stay about 10 seconds. They cost more than a vial or syringe. And some insulin is wasted when you are priming it, 1 to 2 units. And you can't mix insulin. They are already mixed, or you just get them the way they are. It can be easily misplaced or lost because they are easy like a pen. Not all insulins are available in pen form. Must order or purchase insulin separately. There are other methods of getting insulin, and it is let's talk about insulin pumps. It shows in here the picture somewhere. These are the cartridges of insulin pumps. Insulin pumps are small, computerized devices that deliver fast or short-acting insulin 24 hours a day through a catheter placed under the skin. Insulin pumps are popular among those who require multiple daily injections of insulin. Nursing assistants and home care aides are not allowed to administer insulin through insulin pumps under nurse delegation. This is just for you to know. Inhaled insulin. Inhaled insulin is used as a mealtime insulin designed specifically to lower spikes in blood sugar related to eating a meal. It can work faster than traditional injected insulins. A fine insulin powder is inhaled into the lungs through an inhaled like those used for asthma. Insulin then enters the blood through a small blood vessel. Inhaled insulin can be delegated, and it comes with a cartridge like this. You can watch YouTube about this because it shows you how to do it. Most people don't use it, it's not famous yet. But the steps are listed here in the book. The first step is always make sure to have the correct number of cartridge for the client. You will know this from instruction from delegating RN. So that will show you. It's really easy to use it. You just put right here, you just put the cartridge in here and you close it and you suck it. That's it. It's very easy. You can go through the steps. The cartridge should be at room temperature for 10 minutes prior use. Cartridges not in use should be refrigerated and may be used until expiration date. Cartridges in use can be stored at room temperature but must be used within 10 days. Write the discard date on the box. An open strip of 3 cartridges must be used in 3 days. Write this discard date on the strip. Use one inhaler at a time. Replace inhaler every 15 days or as ordered by medical provider. So what is the side effect, or what's a good side or a bad side about the inhaler? The side effect is it's like injectable insulin. Inhaled insulin can cause low blood sugar. The same precaution about the need to monitor blood sugar and how to treat low blood sugar apply to inhaled insulin. If the client develops throat pain or cough, have them speak with their medical provider. If indicated, call the provider. These are the only low size, but other than that, it's very good. It's not needle, people like it. Okay, let's go to lesson 9. This is very short chapter, very short. Syringes are discarded into bright red plastic container. They are sharp containers. This chapter is about safely needle disposal, how we dispose needles safely. Sharp containers are made so they can safely hold sharp infectious waste like used syringes. It's like this, or it can be like this. If a commercial sharp container is not available, a heavy plastic container with a secure lid, such as an empty laundry detergent bottle, can be used. The container must be clearly labeled medical waste, like this. So what we need to do or what we don't need to do, we'll discuss it. What we need to do is immediately place used needles and other sharps in a sharp disposal container. Use an FDA cleared sharp disposal container all the time if it's possible. Follow your community guideline for getting rid of sharp disposal container, or call your local trash or public health department to find out about where you can get rid of it. There is a website on your book. What did I say? Yeah, right here. Keep all needles and other sharps in a sharp disposal container out of reach of the children. As a rule, sharp container when they are like 3/4 full, that's the time to get rid of it. What we're not supposed to do, throw needles and other sharps into the trash. That's a no. And flush needles and other sharps down the toilet. That's a no. Put needles and other sharps in your recycle bin. No, it's not recyclable. Or remove, bend, break, or recap needles. That's a no. It's very dangerous. This can lead to accidental needle sticks, which may cause serious infections. Attempt to remove the needle without needle clippers because the needle could fly off. Usually the needle clippers they work a little bit differently. They just clip the needle, instead of putting the whole syringe in a sharp container. A lot of people use a needle clipper. It just clips the needle and it keeps it there. Usually one small container holds like 1,500 needles. It's very convenient. Okay, now let's go to lesson 10. It's not a big chapter. It's about where to inject and site of injection. Injecting insulin into the same spot repeatedly can cause a breakdown or inflammation of the fat tissue known as lipodystrophy. This causes a dimpling or hardening of the skin. The area tends to have less blood flow, and so insulin doesn't absorb correctly. So the key to preventing this is to rotate the site of injection. Rotating injection site evenly over a large skin area will help prevent this from happening and allowing for consistent insulin absorption and action. There are popular injection areas. In here you can inject insulin like this, 90° or 45°, depending on the person's size. Usually 45°, but sometimes 90°. It depends. Popular injection areas. Your book has a picture. Yeah, this is the injection areas. First is the abdomen. The preferred site for injection is abdomen. You will also want to avoid areas around scars, moles, or skin blemishes. This can interfere with the way of insulin absorbed. Stay clear of broken blood vessels and varicose veins as well. And the outer thighs over here, these are the outer thighs. You can inject into the top and outer areas of the thigh, about 4 inches down from the top of the leg and 4 inches up from the knee. Back of arms, and see over here, these are back of the arms. Use the fatty area on the back of arm between the shoulder and elbow. These areas are also appropriate. Some areas are also appropriate for injection, but usually we don't use them, like hips, upper buttocks, and lower backs. How to properly rotate injection sites. First, choose body part to be injected. Then rotate sites within the recommended body part. It's recommended to stay on one side of the body for several side changes, moving just a couple inches each time. Choose one general area and use all possible sites in that area before moving to the next. Make sure that each injection is about an inch, like 2 fingers, from the last injection. Try to work in a straight row so you don't get confused. Generally, the delegating RN will teach you the best injection angle to use with the client and instruct you on which injection site to use with the client and how you should rotate injections and how to document the site used with each injection. Now let's learn how to mix. Before we go there, let's see how we mix two types of insulin. Some insulins like Clarigan, Lantus, Deramar, Levemar cannot be mixed. These are long-actings. And the others like Novalac 1730, Humalog 7525 are already a combination of the two types of insulin that should not be mixed. But generally, when we mix two types of insulin, step one is roll and clean it, and then add air to the cloudy insulin, and then add air to the clear insulin and withdraw clear acting insulin first, and then draw cloudy one next. We will go in detail in the next chapter. Thank you very much. This model series is very long, so I will do the last chapters 11, 12, and 13 and then the next lesson. Thank you very much.